Testing, testing, testing. Okay, should be working. Hi, everybody. How's it going? Dr. Qazi. I'll wait a few more moments for everybody to join us. For those just joining, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne, on scars, and pigmentation. I'm going to walk you through how I treat temple scars. So look at this. This is how we do temple scars. And I'll explain really just some of the easiest treatments that you could do. Well, not easiest per se for some places, but I would say that if somebody's offering other treatments, be kind of a little bit skeptical, because sometimes what we really need to do is more volume work. And this was what we did with this patient. We did something with Bellafill for this patient. We did do laser and TCA Cross, but the Bellafill worked out a ton. So I wanted to showcase that for you over here. How would you treat dimples in the skin, like on the glutes? So subcision, and then probably a little bit of filler or something that's like a biostimulatory filler product. Something like Sculptra could work out really well, or Bellafill. Yeah, so this was actually, for this patient, this is actually after just a single combination session for him at this point right here. But so yes, we could still improve his after result a little bit more. And in fact, when he came in, we ended up doing a little bit more TCA and a little bit of Bellafill, some more. And then at some point, I haven't seen him in a while. It looks like since September of last year, but I told him at some point we should do another round of laser. So the things to kind of emphasize for this area, especially for the temple area, you can't just go really like high heat, high energy over here. And I see a lot of practices, they make that mistake where they go really, really aggressive in certain areas. I mean, even the cheeks, I had a patient today, and actually two people today. One person did radiofrequency microneedling just a couple months ago, and they still had these like bad marks on their face because they went really strong, really aggressive, and didn't really see much improvement. And this was like they did it several times with that. And then also another patient that ended up doing with Fraxel lasers, and they went really aggressive with a Fraxel laser, and it didn't do much improvement and just caused more pigmentation issues. So pigment, is a major factor when we're talking about really skin of color. But also in the temple area, there's not much that you could do with like resurfacing. It's just like, it's difficult just to resurface all the time. You have to actually just be able to do other tools, other modalities. Like in this case, we did TCA Cross, we did a little bit of Bellafill, like I was mentioning, and then also some of the laser. But the thing is that it's not going to be just with a laser in this case. Look at how deep that is. So we're not going to be able to just cut down with that depth and just like smooth down that area completely. Does microneedling fix this? Well, this patient did do microneedling, many sessions of microneedling, didn't improve his scars. So not going to really be able to say that that's really something that would improve a vast majority of scars, especially when it comes to these kind of acne scars. Can you regain volume naturally? Yeah, you could. I mean, you gain some weight, you could get some volume replacement, but it may not be in the areas that you need it, because with scarred areas, really the fat is actually a lot of times destroyed. It's scarred. It's also like that. People actually don't really recognize, don't really talk about it that much, but fat cells can be replaced really with scar tissue also. So what ends up happening is that even if you gain some weight, it doesn't go where you want it, because out of that area, those little pockets right there, those are actually scarred. Hi, Mrs. Jones. Good seeing you on. And have you come to us at all yet? Because I know you were saying that you were going to come at some point, though, so I wasn't sure. By the way, for those just joining, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne, on scars, pigmentation, and facial balancing. And this case right here, this is for temple scars. I love doing temple because it's an area that I actually had temple scars as well. You can still see a little bit of that right there. See that little pock mark right there. And it's like kind of annoying for some people. You know, it's like the temple area could be an area that people try a lot of different treatments. But for me, I found the best thing that possibly worked was really with Bellafill, doing some lower heat, lower energy lasers over there. TCA Cross, those are things that actually work out really, really well. And that's why I like to have patients I educate patients about, because a lot of times they are told over and over and over again to just do lasers or do microneedling. One of my patients today, he had done a consultation with a dermatologist, I think he was in New Jersey, if I'm correct. And he was saying that they told him to do like, 6-8 microneedling sessions or something like that for his like severe scars. And his scars were like, they had a lot of fat loss. And so it was like difficult to really, and he was a patient of Indian origin. And it's like tough to see what would they really be accomplishing if they went and did a bunch of lasers or microneedling devices on there. It just wouldn't solve anything with that. So really volume, huge. This is Bellafill. It worked out really well. Let's see here. Mari's saying, my dermatologist in California said there was nothing she could do, gave me no other recommendations. That's unfortunate. I have a lot of dermatologist friends in this area, a lot of people that refer to me, and they will tell people that they don't do it, but come to me. And I think that's really the much more ethical way of doing things. Like there's a lot of things I don't treat, and I'm happy to send those out. So it's like really, medicine really should be like that. Coloud is saying, hi, Dr. Qazi. Would a facelift achieve the same result for acne scars for someone in their late 40s? Thank you. Not necessarily. Sometimes there's a thickness around the scars that needs to be solved with laser. Sometimes you still have to do subcision depending on kind of facelift, the location that they did the facelift. And, I've actually had many patients. Just last week, I had a patient who had gotten a facelift done. And it wasn't for the scars, but she was trying to help with the laxity that occurred due to scars, because the scars were pulling down the skin, and then it made the skin really loose around it. And then what ended up happening is that she was getting some jowling, so she did a facelift, but it didn't solve the scars actually. So we have to still work on the scar tissue there. And so it's not like the solution really for a lot of these scars, and it depends on who's doing it and really what location of the face that they have to work on. Do you recommend microneedling at home done correctly for treating medium acne scars? Probably not going to help too much, to be honest with you. Probably not going to help too much for that. How many months between these two photos and how many sessions, please? This was 1 year apart for this patient. And this was actually a single combination that first day. And then we did, this time when he came in again, we did a little bit of Bellafill and TCA Cross. So this is 1 year later. So we have it here pretty much actually exactly, they didn't realize it's exactly 1 year, September to September. And I think I'll probably end up seeing him again, probably close to September time, because he did say he's going to see me again at some point this year, and we'll do a little bit more. So, slow and steady, but that's actually awesome too, because you can sort of see what that process is with Bellafill in this case, because it's not exactly a filler the way people expect it to be. It doesn't actually look the best for the first 3 months or so. It's actually later on that you stimulate that collagen production, and the skin quality looks a little bit better. The scars look a little bit better. It's a lot slower than people think. It's not just going to draw in some water like the way hyaluronic acid fillers do. Is Tretinoin helpful for acne scars? Yeah, in a way, it's going to reduce the oil production, and that helps to actually force scars. It helps the diameter of the scars, but it's not really going to help enough for the vast majority of scars. Like this patient, for example, not going to solve a lot of these. Yes, it's Newport Beach, California. And by the way, guys, you could just book it directly at my page, drqazi.com. Just go ahead there, and you could do a consultation that way. I'll be happy to see you guys. El Burro is saying Tretinoin gel 0.01 or Tretinoin cream 0.05. I usually start really low, 0.025%. And either way, the gel or the cream, it doesn't matter too much. I actually like the cream though myself, because I do think that it's easier for me to mix with a moisturizer, especially for the first couple weeks. And that way, patients have less irritation really for the first couple weeks then. Mrs. Jones saying, thank you for letting us know that we have to be patient for the best results. Absolutely, you 100% do. You just have to be patient with this stuff. And really, that's something that I just have to emphasize over and over again. I think most people, vast majority of patients, we do 3 or 4 cases every single day, and people really do understand that. People talk to me about it all the time. They go through it, and they understand this whole journey. They get it. But I just, because every once in a while, people still insist that they want to get ready for like a wedding in a couple weeks or so. This is not that. Sure, we could do a little bit of filler or something like that for a wedding purpose, but we're not doing these treatments for that. My goal is really for this to be like a long-term solution, a long-term fix. That's the purpose of this. I'm not shooting for like a short-term type of thing. So that's why this looks better over time. It's very, very different than what people showcase, what people say. And nobody could say to us that, oh, this is due to swelling or something. This is 1 year later. And this is, an actual real patient, a real person. And that's his journey. It's like sometimes in the middle of that process, not particularly for this patient, but sometimes I'll show results of people who in the middle of the process, they'll say, well, I don't see enough improvement. But then several months later, they'll say, oh yeah, it did solve it actually. That was it. I just had to be patient. I just had to wait. And a lot of times it's just like, yes, it's exactly a process. Exactly. And so it's like people have gone through so many different things so many times. And it's like, it's slower than people expect. Sometimes people just sort of want this thing to just the magic wand, but these are scars. These are things that are damaged. The tissue on top is damaged. You can see that the fat is damaged, and it takes a lot of work, a lot of time so that we can get this to look really, really good and stay really good for the rest of your life. The purpose of this is that you do these treatments and you get to keep your skin. You get to keep the way it's looking and making you feel. Yes, you're going to have some fat loss over time. I get that. But like overall, it should be that this is like your skin. You get to keep that. And that's awesome. I mean, that's a really, really good feeling for people that that's the process. I'm not super, because if you want it that way, I could do it that way, which is a short-term effect. Of course, we could just plump you up full of like a little bit of hyaluronic acid filler. But the way I wanted it for myself was I want a long-term solution type of thing. So like, I'm not the kind of person, even to this day, I can't go back and forth at all. Like it's very, very difficult for me to go to any appointments or anything like that for anybody because it's like, I'm super busy. So I know other people are really, really busy. And it's like, I don't want you just to have to keep on coming back over and over and over for the same thing over and over again. Like if there's different steps, that makes sense. And I had to do that same thing for myself, but like each step is like part of this journey that's getting us to this the proper destination. I'm not just repeating the steps. I think that's really silly just to keep on repeating the same thing over and over and over again. It just doesn't make sense. And it's like clear that you're just not doing it right then if that's the case. Does dermal stamping help? Well, it helps better than, I would say, like microneedling, rolling microneedling devices. It's a little bit better than that, but not going to help enough for a vast majority of types of scars that I'm showcasing over. If it's more mild cases, then maybe. Do you recommend LazyMD? I used to have LazyMD. It's okay. I don't know what you're using it for, but it's okay. It's okay for picking up a little bit of pigmentation, especially in lighter skin types. But I actually gave up my device actually years ago, and I just found the Pico was so much better for myself. Let's see here. Do you recommend? Oh, can I use Tretinoin with high frequency wand? Well, that's just like you're kind of potentially going to cause more chance of post-inflammatory hyperpigmentation, more redness. Wouldn't recommend it. And by the way, a lot of people always ask me about red light when it comes to patients who are skin of color, people who really have pigmentation that's potentially deep inside there, or it's just already out because they've been out in the sun, they have melasma. Really not recommended, especially after we do these scar treatments. I mean, you're really at risk now of getting pigmentation then. So I would not recommend it. There is a little bit sometimes too much heat, too much energy. The other thing I found is that a lot of people don't actually use the lenses that they're supposed to be using for that. There may be a risk really for eye injury, the way some people are doing it. Natalie's saying, someone recommended me Scarlet RF, but I'm scared of fat loss. Does that happen with radiofrequency microneedling? Yeah, if it's being for scars, then yes, there is a possibility because people may end up using too much heat, too much energy for the scars. I wouldn't recommend that. It's not a good idea, really. Can you use the Pico on skin types 5 or 6? Yes, absolutely we could. I do it all the time. We absolutely do. Baron is saying, what's the best laser in regard to CO2 for acne scarring that gives the best possible results? What kind of scars do you have? It's not about the CO2 laser. Let's just see. What kind of scars do you have? Because that's going to be determine what we could do for this. Ali Shads is saying, Doctor, I've tried everything to get rid of my sunspots, including hydroquinone. Nothing works. Tips, please. Well, you may have to see somebody for a Pico laser, or depending on your skin type, you could actually just consider even just a quick IPL treatment. IPL, BPL could actually work well. Earlier, someone was asking about LazyMD. That could actually help as well. So laser helps out really, really nicely for sunspots. Depending on your skin type, I mean, I have a lot of patients who are darker skin types, so I usually use a Pico laser. So yeah, IPL, you said you're brown skinned. IPL is not going to be great for your skin type, but Pico laser could be a good option there. We still need to suppress the pigmentation so it doesn't come out really. What do you think of hypochlorous acid spray for redness? It helps a bit with that. We carry a really good one we got it compounded from a pharmacy, and it works incredibly well actually for our patients. We do a lot with our acne patients with that. The thing is that sometimes that redness is due to the fact that there's like this bacterial overgrowth on the surface of your skin. So in that case, yes, it could help out for us, but there's probably other different reasons why you have that redness, and you probably have to solve that. Do you recommend glycolic acid for melasma patches on the face? Not as much. I mean, really, it's like the process of melasma is much more complex than just a matter of just picking up some surface, like just doing some exfoliating like that. That's not going to help really, because really there's a vascular component to it, and you really have to remodel those vessels. And sometimes that involves lasers, sometimes it involves oral medications, topical creams, but it's really not going to help really with glycolic acid that much. Now, that could help a little bit for somebody who is asking for sunspots. That could help more for sunspots, but for melasma, it's a very different process. For people that are wondering, basically, melasma is really where it's like this blotchy form of skin. It's kind of usually on both sides of the face, this blotchiness, and it's like really a lot of times very dense in some patients, and it just looks very different than like the circular sunspots that people may have. It's not a sunspot. I've had a lot of people that would say, well, I was told that, one of my friends told me it was due to my liver, things like that. It's not due to that. It's really due to genetics. And then it gets worse with sun exposure, heat, and hormonal changes. So all those things. Sorry, I'm catching up. What did you say would be good for these kind of scars on the temples? So in this case, we did TCA Cross, which is an acid we place at the base of the scars. And then what we also did was we did a laser to resurface the edges of the scar. And then I did something called Bellafill, which is basically 20% of that is PMMA, which continues to stay there underneath the scar tissue. And then 80% of it is cow collagen, which teaches your body how to make your own natural collagen. So it works really well for scars, especially because you're making some new collagen over there, which had gotten destroyed from the scars. And then on top of it, you always have something to support there. What is the most effective but also cheapest treatment for acne scars? It depends on the kind of scars again. And it's really tough to say. If it's ice pick scars, and TCA Cross could be the cheapest option for you. And if it's more like rolling scars and potentially subcision, if it's something like I guess I have to also determine like what your budget is though too, and what you're trying to achieve. John Loves is saying, would anything just topical really get at these or not so much? No, not so much. I mean, this patient did those things. He did microneedling before, did a bunch of, I can't remember. He told me a long time ago how many microneedling sessions. I think probably like a couple years ago, he told me that he ended up doing 2 microneedling sessions. Several microneedling sessions, but I can't remember exactly how many he did. Would you consider using the Lutronic Hollywood Spectra for ice pick scars? No, it's not going to really help much for ice pick scars. Not going to help much for that. Antibiotics for acne. Well, I usually use more topical antibiotics. I usually use more things like clindamycin, and something that people don't really use enough really is dapsone, which is a sulfur-based medication. It'll help clear up some of the bacteria that really is on the surface of your skin. If you need to, because it's just basically like there's a lot of bacteria, cystic lesions, then yeah, you do want to do an oral antibiotic, but I just do it for shorter bursts than a lot of people. I did it actually. Thank you so much. So I did it actually when I was a teenager, especially, when I did it myself, actually, when I was a teenager, it was like the dermatologist would put me on it for months, like 6 months, a year, I feel like, just really, really long term. And I really just did a number on my GI system, so I don't do it that long, actually. Her name's Izzy. I have similar ones. My derm recommended microneedling or laser. Why do you suggest TCA? So yeah, the microneedling or TCA is not going to help enough, really. I'm sorry, microneedling or laser, it's a lot of times for those ice pick scars isn't going to help enough. You got to go right at the base of it with something that's going to break it down directly, and that's where I do TCA Cross. Puppy's Izzy, short for Isabella. Let's see here. Oh, thank you guys, appreciate you. What will help my dark circles? Use CeraVe Vitamin Eye Cream, looks moist but no darkness the same. I guess I'm actually confused here. What will help my dark circles? Use CeraVe Vitamin Eye Cream, but it looks moist, but the darkness looks the same, I think is what you're trying to say. So it depends. Okay, so basically here's how I can test it. So kind of take a look over here. I mean, don't do it right at this moment, but look in front of the mirror, and you'll see that like if you pull down, is the pigmentation kind of following along with your skin? So is it basically like going down with as you pull down your cheek a bit there? And then you could determine, okay, is that really like true hyperpigmentation? But you may see that like it actually is not shifting. And likely that's actually because there's actually blood vessels that are underneath there that are trapped that you have to target those blood vessels. And that's a totally different process. So 2 different things. So let's assume that you pull down your skin a bit. And I see this a lot with like South Indian patients, for example. Very, very common. I do a lot of actually where I do the Pico laser around there. It works very, very well, incredibly well for that actually. And especially that demographic, it just responds incredibly well because there's just not many treatments you could do. You can't do like peels over there because it's just too aggressive a lot of times. There's a lot more irritation there. You can't really do too many creams, for example. So the Pico laser works very, very well. So that's what I usually recommend doing. Pico laser around there if it's true pigmentation. But if it's vessels, then you may need to do something like a vascular laser, like XLV is what I use. That usually helps out too. If you're trying to help with just more like getting a little bit of skin, just some new blood flow there, improving the skin quality there, then you can consider something more like PRP injections or PRFM. Basically what that is that we get your blood, we're going to spin it around, and then we get the growth factors from there and then re-inject that underneath there, and that helps out pretty nicely. John Loves, by the way, I like the name actually, John Loves. A lot of people have like these other kinds of names that sometimes aren't like as positive. I like that. About how much does TCA okay, let me just start over here. About how much does you said TSA, but I think you're saying TCA Cross cost, and how many sessions did this take? So TCA takes several sessions a lot of times, especially for deeper ice pick scars. It could take really, depending on your collagen response, like 4 to 8 sessions, depending on what kind of scars, how deep it is, and the location on your face. Our prices are on our website. So for those who don't know, I do a process where if I do a combination session, for example, for this patient, for example, and we do a combination session, we did several things really to get best possible results. Now, future sessions are 55% off for the TCA Cross, the laser part. He gets that heavily discounted now in the future. So our prices are on our website. Go to drqazi.com. You can see all of our prices. The only thing that's not on there is subcision, but I can tell you on average, most patients spend about $800, sometimes to about $2,000 for subcision, depending on the complexity, depending on if we need to do excisions, things like that. I would say that on average is closer to the $800 to $1,200. If it's more like small localized spots, it could be a little bit less, but that's typically the price to point though for it. We're in California. We are in Newport Beach, California, just about 5 minutes from the airport there. What do you recommend for PIH in the middle of uneven texture from cystic acne rather than acne scar? So you could start with Eucerin's Anti-Pigment cream. It's a good option, actually. It's just something you can get over the counter. Just make sure you get the real, true form of it. And it works out. Just it takes a little longer. It's a slow process. It take about 2-3 months, really. But that could help out, though. And the same person is for you, someone you're saying about inner thigh pigmentation, Eucerin's Anti-Pigment cream. Actually, start with that. Works out really, really well. And it's something cheap. I think it's like $35, something like that. It's not bad at all. So it's like one of those things that gives you a nice return on what you're getting, and it's safe. You could continue using it. So it's got diamidol, which they patented. I kind of wish they didn't because it would be really nice to people use it for a lot of things. Sign up and saying what cream? Eucerin's Anti-Pigment cream. Just something over the counter, really easy. I don't see many people pushing it, interestingly enough, but it actually works really, really well. It's really underrated. I think it's kind of funny because people seem to assume that it's like, just because it's Eucerin, it's not great for some weird reason. Just like I use like a lot of like Cetaphil, CeraVe, things like that, moisturizers, and then it's like it turns out that you don't need to do any of those things. You don't need to do like those extra like really expensive creams and things like that for the vast majority of people. Just Cetaphil, CeraVe, those things work out really well. Vanity cream. So Eucerin's Anti-Pigment, it's their pigmentation cream, not the night cream. It's called the Anti-Pigment cream. And the night one, I think, had a little retinol. I got to double check offhand. I can't remember. I think the night one has a bit of retinol. So the regular, actually, let me just double check. There is one thing that I think they had a new form of it that I thought was okay for a lot of patients, but for acne-prone skin, I found that it was making a little bit more irritated. I think it was for like the oil control one, which I thought was actually surprisingly more irritating for people. But yeah, Eucerin's Anti-Pigment cream. This is the original one. I'll take a look to see if the night cream, what that was eventually after I get done with tonight. But I'll take a look and see that one, what it was. There was something about the oil control one, though, I thought was not great for acne-prone skin, interestingly enough. Is hydroquinone good for hyperpigmentation? For a short burst, it could be, but you could try again that Eucerin Anti-Pigment cream. Try that. Maria's asking, where can I send my pictures through email? So look forward to seeing you. Just schedule a consultation to go to drqazi.com and schedule it over there. Just do it that way, and you can be able to set up they'll give you instructions essentially of how to do the virtual consultation. Do it all the time, and you can be able to set that up that way. And if I have acne, should I shave with razor or foil shaver? Use a razor for sure. You definitely use a razor. Do not use electric shavers. It actually could cause more scarring. Sometimes it could cause hypertrophic scars as well. And actually, you know what? I took a bunch of photos this weekend of like my skincare stuff. I'm actually going to showcase it over like the story at some point. But I was showing a couple things because a lot of people don't understand for shaving, you don't need like these heavy creams, all that kind of stuff. You really don't need that. So like instead, actually just like using like even like Cetaphil's gentle cleanser actually for shaving actually works out really well. So consider doing that. I gotta take my my dog out though for a walk, guys. So I will see you guys on tomorrow night. There we go. So I gotta go take her out. So I will see you again tomorrow night. And look, if you need any other questions, just keep on messaging me and we'll take a look and see if we can help out for anything else, guys. Take care, guys. Have a good one. Bye.